established by World Health Organization in late 1940s. There are diagnostic codes that create a uniform vocabulary for describing the cause of injury, illness, and death. Actually, it is in the alphabetical order. Okay, first it's alphabetical table and tabular list. In alphabetical list, they will give all the diagnostic codes. For example, fracture. Okay, we are taking the fracture code in the alphabetical tab. It's the first set. Next, we are taking the code. Fracture code, it will be, I guess, M84 or M83. It will be in M series. Okay, we are taking the fracture code, and next we are seeing the tabular list when the injury was happened, or how long the break is. Okay, there will be in which location. Okay, how severity level, everything will be in the tabular list. We need to take first. We need to take the alphabetical code. Next, we need to go into the tabular list, and we want to take the extra additional codes, and we need to combine. Actually, ICD-10 code will be a 7-digit alphanumeric code. Okay, it will be 7 digit. I'll explain this in the next slide. It has been updated several times. Okay, this is a 10th edition, which is currently in progress. The code is currently used in United States ICD-10 CM. What is this CM? It's a clinical modification. What is called CM? It's a clinical modification because it's all updating each and every day. Each and every day, new conditions are emerging, right? In our body itself, we are too young, but the condition is not like a Asian period because we're having lots of disease, lots of disabilities, very tiredness because of food, our lifestyle, everything got changed. So new conditions are coming into picture. So this ICD-10 CM, it's a clinical modification, is updating for each and every time. Okay, this was introduced. ICD is introduced in 1940s. Within this many years, nearly there is 80 plus years. Within that, the 10 editions goes gone. Now it is a 10th edition is in progress. Okay, ICD codes are used to represent doctors' diagnosis and patients' conditions. Okay, already I have explained this. What doctor diagnosed from the patient and what are the conditions was tested in the patient. All will be coded here. This is the ICD-10 code structure. The first, actually, I explained you, right? It's the 7 digits. The first 3 digit is called category. The first 3 characters is called category. This was taken from the first part. It's an alphabetical table. Like how we have in a medical report itself, they will be giving it's a fracture. There is a discontinuity in bone. It is a fracture. It is in right shoulder. It's due to some stress on the right shoulder, and it is the first encounter or the second encounter. They will give everything in the medical report. This need to be coded now. Okay, what is the main issue? It's a fracture. Okay, now we want to check in the tabular list. Okay, we need to check in alphabetical order. We need to take the fracture. Under fracture, it is a disorder of continuity of bone. We can take the code M84. Okay, the first 3 digits we have taken. Category we have fixed now. Next, we want to go to next 3 digits. It is etiology, anatomic site, and the severity. How severe it is, and which is the site of the fracture. Everything we need to see now. This also we need to see in the tabular list. It is a stress, fracture, right shoulder. These information will be printed in medical record. With that, we need to take the code. This is 311. Okay. At last, it is extension. Okay. For major things, the extension may not be available, but in few cases, extension will be available. It's only one character. Okay. It is initial encounter. Whether it is an initial fracture, sometimes for some players, kabaddi players or some football players, they may several fractures will be there, right? So it may be second, third, fourth encounters, or will be it's there in a same site. So we need to mention that as well. So it is an initial encounter, so it is A. Okay. This in every conditions, the first 3 digits. I mean, the category part will be available. Okay, category part is very major and it will be common for all the conditions. And the fourth, fifth, seventh digits are it might be applicable or it might not be applicable. Okay, in the what is the conditions given in the report? Based on that, we can code. But the first three categories is confirm for each and every diagnosis. Other last four, it will be in the rare case. It might be there or might not be there. Okay, because medical report, they, for sure they will mention it is a fracture, but they might miss to mention where is the fracture, or it is happened by stress or some other reason. There might be missed to file the encounter also. So the last four it will be may be applicable or may not be applicable. But the first three category, first three digits, this category, it will be sure for sure. Next, the CPT. It is current procedure terminology. Okay. It is used to, this is not in progress now, but we need to know what is this CPT. It's used to document the majority of medical procedure performed by the physician's office. This already we know this. We need to code the procedure. But in CPT, they are coding only the procedure. But ICD-10, it's not like the conditions, procedure, treatment, everything will be covered with it. But in CPT, we are coding only the procedure. And it is published and maintained by AMA. What is that? AMA, American Medical Association. Okay. In CPT, it's a 5 numeric codes. Okay, the 5 numeric codes, it's divided into 3 categories. The first category is CPT codes are based only on the 6 major medical fields. 6 major means it may be oncology, cardiology, pediatric, some gynecologists. These major 6 medical fields codes will be covered here. Next, the second category, it corresponds to perform measurement, laboratory or radiology test results. All results will be covered here. And corresponds to emerging medical technology. Okay, these 3 are the categories under CPT. Okay, next HCPCS. What is HCPCS? It is Healthcare Common Procedure Coding System. It's also developed by CMS, Center of Medicine and Medicaid Service, and maintained by, this is developed by CMS, but is maintained by AMA. And this also corresponds to service procedure documents not covered by CPT. Which of the sections not covered by CPT will be covered here. Okay, but in ICD-10, everything will be covered. It is an official code set for outpatient care, chemotherapy, drugs, etc. It will mostly HCPCs will be coded for outpatients. Okay. Okay. Now we are moving into medical record. The term medical record are used to describe the systematic documentation of patients' medical history across time within one particular healthcare provider's jurisdiction. Okay. Medical record already explained you. The medical record means the provider examining the patient and is documenting every conditions or the procedure or the treatment done to the patient. He was denoting all that, and the transcriptor, medical transcriptor is transcribing to a medical record. I'll explain this. So the two importance of medical records contributes professional care rendered to the patient, reflect the quality care rendered by the institution. Okay. In medical record, there are 3: inpatient record, outpatient record, and emergency. Okay. Okay, these are the elements of medical records. We are saying medical records, they are recording all the conditions. Okay, everything I'm saying. But what is that? What are the elements were there? Okay, we need to know that. First is chief complaint, history of physical illness, past medical history, surgical history, social history, family history, review of system, problem list or active problem list, vital signs, physical examination, assessment, impression, diagnosis. Okay. With this name itself, we can understand everything. Chief complaint will be the what for major. I might have diabetes and hypertension, but now I'm going to examine my fracture in my right leg.